Good afternoon. We're here with Dr. Morton Kahlenberg, who is a board-certified surgical oncologist specializing in the surgical treatment of cancer. How are you, Dr. Kahlenberg?
I'm well. Thanks for asking. How are you?
I'm doing well. Thank you so much. Thank you for spending this afternoon with us. I just wanted to ask you some questions related to the continued medical care for some of our patients in the Baptist Health System. I know that you're part of the Baptist Network for Cancer Care, and a lot of people right now are nervous about coming in and continuing their treatment. So first and foremost, I wanted to ask you, is it safe for patients to come to the hospital to receive treatments related to their care?
It absolutely is. I know it's an anxiety-provoking time, a challenging time for so many individuals, but with a lot of the safeguards that the hospital system has put in place, it absolutely is safe and actually would be dangerous to delay care when care is needed. So it's very safe as far as coming in. Patients are screened. There's on-site COVID testing for patients who actually need procedures to be performed. And we really have a very strong algorithm to ensure patient safety. Staff takes all of the usual precautions. The hospital's taking the appropriate precautions. So it is absolutely the right thing to do to come in to proceed with or initiate care or treatment.
Okay, great. So how can somebody confirm if they should continue with treatment of their plan? Should they consult with their physician and talk to them on the phone about that, or what's the best recommendation?
So the best recommendation is communication with one's physician, one's oncologist in the world of cancer. And depending upon how the oncologist is seeing patients, either virtually, as we're doing now, or live and in person, I would start, frankly, with the safest approach being a phone call. And sometimes by working with the physician or the support staff for the physician, patients can get the answers that they need. And then the arrangements can be made for patients to come into the hospital, whether it's for treatments, procedures, all of the above.
Okay, excellent. So what type of safety precautions, if somebody is coming into the hospital, what type of precautions should a patient or their family members take when they're coming into the hospital? So for immediate and planned care, so should they wear face masks, practice social distancing? What do you recommend?
So all of the above. We need to be as diligent as we can be with all the CDC precautions. So at minimum, that means face mask wearing, social distancing, of course, hand washing. You make an important point as far as family. Right now, out of an abundance of caution, like other health systems throughout the city and throughout the country, there are no visitors to join patients in the hospital at this time. And while we know that causes anxiety for a lot of individuals, and nobody likes doing it, but that really is, again, under an abundance of caution. So at minimum, patients need to come in with masks, social distance as best you can, rely on the fact that staff is doing the very same thing. The hospital workers, the nursing staff, support staff, physicians are all practicing the same thing. You will not see anybody walking the hallway of a Baptist facility without a mask. Hand washing stations or sterilization stations are everywhere. Gloves are being worn. So all of the cautionary steps advocated for by the CDC are being taken.
Okay, wonderful. That's great to hear. And hopefully that would put people at ease who need to come into the facility for treatment. I do have a question about medical emergencies. If somebody is having a medical emergency related to their condition, what should they do for their immediate care?
Well, almost behave as if COVID is not an issue for society. So if a person needs emergency care, emergency rooms, usually attached to hospital facilities, are your destination of choice. And rely on hospitals to have, as the Baptist Health System has, COVID area and, more importantly, non-COVID area for patients accessing an emergency room. So the emergency rooms have done an excellent job at triaging at the front, temperatures, symptoms, and if there's a concern for COVID, they will make sure patients are grouped in the right way. So anybody experiencing a situation that would be deemed a medical emergency, although it is anxiety provoking in the era of COVID, rest assured that the place you need to be is in an ER setting, usually by calling 911.
Okay, okay, excellent advice. Thank you for that, Dr. Kahlenberg. Well, Dr. Kahlenberg, is there any other advice that we'd like to give to our community to just let them know to not delay receiving care, especially if they have something that's medically time sensitive? Any other word of advice that we need to share with our community?
Sure. And the key thing is to remember the CDC guidelines. I know that there's been a lot of opinion, not necessarily from the CDC or from knowledgeable physicians, but in the community. And especially for individuals that we're talking about who have medical conditions, face mask wearing, social distancing are the mainstay to preventing COVID. And we know that the people that you and I are talking about today are the at-risk population. Mm-hmm. And there's no more deserving a population that needs to adhere to that. I get a lot of patients who say, boy, I'd love to have a family get together before I have my big surgery, or I really miss my family, my friends. I'm just getting various types of treatment, and I'm living alone at home. While my heart goes out to them, the alternative is far worse, which is contracting COVID because you have pre-existing medical conditions. So we try to encourage our patients. The health system tries to reinforce that message. And that's what I would really say. Forget about the politics. Face mask, social distancing, hand washings are absolutely fundamentally the key to helping to prevent COVID transmission. There's no doubt about that.
Excellent advice. Thank you so much for that, Dr. Kahlenberg. Ladies and gentlemen, if you have any other questions related to COVID or about the information here, you can visit our website at baptisthealthsystem.com. And you can also continue to check our social channels for updated information. Dr. Morton Kahlenberg, thank you so much for your time this afternoon. We appreciate your time. Stay safe, sir.
You stay safe, and thank you for your time. Appreciate it.
Thank you.